with exercise breaks at work. It used to occur to me that I would see people going outside, they would stand outside the doors of the Capitol, they would smoke on state time. Now, if they wanted to walk, run, or do some exercise, we tell them, okay, you need to do that on your lunch hour or before you come to work or afterwards. And it just didn't make sense to me. I'm thinking, okay, if you want to hurt yourself, we subsidize you. But if you want to improve yourself, you're on your own. It doesn't make much sense. Here's another one. What do employees get when they're sick? Sick leave. You get time off from your employer because you're sick. And we all understand that that's a good thing. But what do you get when you aren't sick? And as I looked at state employees, I realized here's what we did for our state employees. If you're sick, we give you time off. If you're never sick, you get to work extra for all your sick colleagues. Now, where's the incentive in that? And then sometimes you end up almost creating this sense in which people will call in and fake their cough so they can take the day off. So we decided, you know what, we're going to start rewarding the employees who aren't sick very much by letting them earn points for not smoking, for measuring their steps in a pedometer, for not being sick. They earn points and they get time off. And it turns out that you get better employees, happier employees, more productive, and the time that they are working is time better spent. The system has to be changed from the bottom up. And if we're not going to do that, then the idea of universal coverage being the primary goal is only going to move us to bankruptcy sooner rather than later. Now, is our goal a good one, to say we ought to have everybody covered? Sure, that's a great thing. And you'll hear people talk about the 47 million Americans who don't have coverage. Those are powerful numbers. Of course, in those numbers, about a third of those people are self-insured. They're wealthy enough that they don't want or need or care to purchase third-party insurance. About a third of those could afford it, but they're healthy, they're young, they don't think they need it. Now, frankly, they do, but they don't think they do. So they'd rather have a nicer car or a larger apartment, and so they just choose not to. There are a third of the American population that absolutely can't afford it. I mean, they really are working without a net. And those are folks that really are in the crisis stage. And then of the others, there are many people in our country who have some form of insurance, but they're underinsured for major catastrophic illnesses or calamities that may come. Still, the problem is that our system is based on the idea that we're not going to do much for you until you're really, really sick. For example, in many coverages, we don't cover the $150 visit to the podiatrist. No, we wait until it's a $30,000 foot amputation. We don't cover a couple of $100 for you to sit and talk to the nutritionist. Nope, we wait until it's a $100,000 quadruple bypass. And again, as long as we're thinking in those kind of terms, we're never going to be able to catch up to the incredible cost of care. Part of our challenge is that our care is built around uncompensated care. So if you're actually paying, you're not just paying your medical bills, you're paying for the people who didn't pay. And that is one of the reasons that there is a good reason to have universal coverage, so that the pool and the risk is spread with a larger sample of the population. When I said earlier that the real challenge is not health care, it's health. Here's the challenge for us. How do we change the culture? Because that's really what we're talking about. It's not so much just changing a program. It's changing the culture. And our culture has really shifted. Nobody knows this more than me, because 5 years ago, I wouldn't have gotten up here and talked about health. Reason why? I was the maybe textbook example of what not to do. Although I never smoked because I was allergic to tobacco, I certainly made up for it in overeating and under-exercising. I was a classic couch potato. Did not believe that exercise was anything other than time that I couldn't do other things that I deemed more important. The last time I'd ever run was in the 8th grade, and a very sadistic physical education coach required us to run for 1 mile at the end of the school year in order to get a passing grade in PE. It took me about an hour to get it done. And I hated that guy. I really was mad at him. And I said, one day I'm going to be the governor and I'm going to audit his taxes. I'm going to make him pay. So the day I was sworn in, there was a U-Haul at his house, and he moved out of state. He knew I was coming after him. So I didn't run again for all those years until I went through my health crisis. My doctor set me down about 5 years ago, and he said, if you don't make a lifestyle change, you're entering the last decade of your life. And then he did a great favor for me. He described that decade. And as he did, I realized that I needed a new exit strategy for my life. And that's when I made some significant changes in nutrition and started exercising just a little bit at first, and then adding on to it to the point that one thing led to another. And as Jim has mentioned, I've completed 4 marathons. And I wanted to be sure and say I didn't just participate, because that means you went off the starting line, you ran half the block, collapsed, and said, that's it, I participated. And I actually got the medals for 4 of them, and I'm training for my 5th one now. Now, I want to say all that because if a guy like me, who is so Southern fried, that I could change my lifestyle, because I know you've got a few fried things up here in Iowa. Guys, you don't understand what fried food is until you get south. We fry everything that we eat. Vegetables, meats, breads, it doesn't matter. If it can be eaten, it first must be battered and fried. And if it's an entree, we pour gravy on it. If it's a dessert, we put sugar on it. That's and a lot of people have never understood that. It's a cultural thing, and in part because so much of the culture of the Deep South is rooted in poverty. And as a result of that, anything you could do to add caloric content to your meals without adding cost was a matter of survival. So in my family, going back for many generations, it was not just that we liked the taste of fried foods, although clearly we acquired that taste. It was also a matter of economic survival, because I don't come from a long line of noble and blue blood ancestry. Anything but. My dad always told me, don't look too far up the family tree. There's some stuff up there you don't need to see. Now, having said that, all these reporters will go looking up the family tree. I'll be like that young man. He had a date over at his house, and he was showing her some old family photos in an album, and came upon one, and he suddenly remembered he forgot to take that one out because it was a picture of his great-great-great-great-grandfather. And this particular relative upstream from him had actually been hanged for horse thievery many years before. And sure enough, his date pointed to that picture and said, oh, who is this gentleman? He was just heartbroken. How is he going to explain that in his bloodline is such a hideous person? So finally proving that he had a great future in politics, he gave one of the greatest spins ever. He said, oh, that's my great-great-great-great-grandfather. And he was unfortunately killed in a very, very sad accident. He was participating in a public ceremony when the platform on which he was standing gave way. My own eating habits, however, had developed for many generations. I am the first male in my entire family that ever even graduated from high school. On my mother's side of the family, I'm a generation away from dirt floors and outdoor toilets. So I understand something of what it is to break from that long line of poverty, even though we didn't even know to describe it as such, because we were just like most other people. And my dad was one of those guys. He worked 2 jobs, very proud person, wasn't going to take anything from anybody. He worked as a fireman in the city of Hope, Arkansas, and on his days off worked as a mechanic. A guy that worked with his hands. And the only soap we ever had in our house was lava soap. Some of you know what that means, don't you? I was in college before I found out it's not supposed to hurt when you take a shower. Some of you spend real good money on an exfoliation. Bar of lava will do the same. But because of the eating habits, nutrition really wasn't a major focus of my life. And because I wasn't really that great at athletics, my lifestyle was anything but given toward physical activity. I'm somewhat of a maybe microcosm of the rest of the country. And now we face not just a personal challenge, a national challenge. And childhood obesity is the greatest threat we really face. And there are some who think, well, that's not really a real challenge. That's just sort of the disease of the month club that people are creating so government will have something to be worried about. Well, for those of you that doubt that we have a serious issue with childhood obesity, I've got a little test for you. And I promise if you do this, you will never again question whether or not this is a real threat to the future of our country. When you get home tonight, dig through your scrapbooks. They may be in your attic or under the bed or in the closet somewhere. Dig through your scrapbooks and find a picture of you and your classmates.